Well, the foster care system is pivotal in making sure children are able to find good, loving homes, but many might not realize how many kids are in the foster system at any given time. Joining me to talk about that and the differences their companies are making in the world of foster children is the CEO of Foster and Heart, Kate Wilson, and Senior Project Manager at Optum Idaho, Zach Stahl. Thank you both for being here today.
Thank you
for having us.
Of course. All right. So first question I wanted to aim at you, Kate. And of course, I want you to tell us, how do so many kids end up in the foster system? How do they end up in general? And what is your company, Foster and Heart, doing, or the role you play in the current system?
Well, children end up in the system because they are found in imminent danger. There's a variety of different reasons, but abuse, substance abuse, traumatic events happening in their home, and obviously CPS is involved. People can report situations where they're concerned about kids, and then they're brought into the system. We're seeing a lot of kids come in because of the economy right now and just what's happening in the world, and so there's just an influx of children coming in, especially in Idaho, but across the nation. And so Foster and Heart, we were birthed out of, I saw a need for sibling groups to be placed together. And so I just basically started this nonprofit. Our mission is to just meet the needs of children entering into foster care and to meet the needs of children in care by creating community and getting the community involved in meeting those needs.
Beautiful. That's great.
Yeah.
Now, Zach, how about Optum? What role does Optum play in the foster care system?
Yeah, of course. So our company has the contract with the state of Idaho Division of Medicaid, and every child that comes into the foster system is placed on Medicaid. And so all foster children are our members. And so when a child goes to any kind of outpatient behavioral health service, Optum is the one that's, we have that network of providers that provide those services, and then obviously we pay those claims and make sure that those kids get connected into care.
Fantastic. Now, I have the pleasure of knowing, or I just found out, both of you are foster parents yourself. So why don't you tell us about the process of, I guess you can say, navigating the whole process?
Yeah, it's a lot like drinking out of a fire hose. There's a lot of immediate needs that you have to meet and navigate. There's a great training that they take you through in order to understand, where these kids are coming from and how to meet the needs of a kid that's gone through traumas and things like that. And then you just basically you wait for the phone to ring, and then you get connected with a kiddo that needs a safe, loving home, and you do your best to provide that for them.
Yeah, great.
Yeah. Basically I'd say you kind of get in with an expectation, or you think you know what you're getting into, and it goes completely different. And I signed up 5 years ago to foster one child, and I ended up fostering a sibling group of 5, and by the time I got them, I had 5 kids under 4 years old. So completely not what I expected, but better. And it's been just an incredible process. At this point, I've fostered like 65 children. And so again, it goes back to, you get trained, but you prepare the best you can, but also expect the unexpected.
So knowing the foster kids, they have access to that behavioral health services through Optum. Can you tell us a little bit more about what that looks like?
Absolutely. So our network of providers, we have about 2,500 providers throughout the state, and they provide everything from assessments all the way up to partial hospitalization. And so any kid or any Medicaid member that needs care can go to optumidaho.com and search for a network provider and find somebody that's going to accept their Medicaid benefit and get care scheduled right then and there. We don't require referrals or anything like that on our end in order to get into care, which is great. Additionally, we do other things to try to make the system a little bit easier to navigate, such as we created a transitional age youth guide for kids that are transitioning into adulthood, which is a difficult time for anybody, but especially for children that are in foster care who maybe don't have the same network of support. And so it helps them navigate that difficult time in their life.
Yeah, great. Now, both of you as foster parents, Obviously, I can only imagine you've seen or heard a lot from them. You know, not an easy life it's been for them. So tell us, in your own opinions or your own words, a little bit about the importance of getting that behavioral health, those services, I should say.
Yeah, absolutely. So studies have shown that children in foster care are, I think, up to 3 times more likely to have up to 4 or more adverse childhood experiences, or ACEs. And there's numerous studies about the impact of ACEs that can have on both mental and physical health. And so just having, support to, process trauma and to work through, what may look like a behavioral acting out, but it's really just the impact of trauma that a child has had. That's really crucial, and the ability to get into care early has proven to be really, really helpful as well.
Gotcha.
Yeah. I would say, too, as a foster parent and just working with the foster care system, knowing that those services are available for you is very vital and crucial, because when you get a call for a kid, they kind of tell you, hey, this is what they've been through, this is what's going on, this is what they're coming from. And, on my own, I might feel not like able to take that on, but knowing that there's services out there able to provide that and help the children process what they've been through is just so vital.
Yeah, what a big help. I can only assume that is right there. Okay, so let me ask Kate, what would you say makes someone a good candidate to be a foster parent?
Honestly, if you have a heart for children going through hard things, just a heart for children in general, and just being able to open your doors to vulnerable children is key. And I would say, too, I got into it, I had a heart for kids. I've always loved kids, and I knew this was something I was going to do when I was an adult. But one of the other things is I would say have a heart for these parents who are going through really hard things, too. And I think I didn't expect that. My first time meeting a biological mom, I was like, my heart broke for her, because we see a lot of these things, they're generational things that are happening, and maybe they didn't get the help they should have had, or they didn't have the adults stepping in to help their parents. And so I really have a heart to help parents too. So 2 things: have a home, a loving environment, rely on your community to help you, but also have a heart for kids and bio parents.
Yeah, that's beautiful. All right, last question for both of you. Kate, we'll start with you.
Okay.
As a foster parent, what would you say is your favorite thing about doing that?
Oh my goodness, I love the children. My favorite thing, but also just watching the children transform before your eyes, seeing them come in. A lot of kids come in your home scared. They have no idea what's going on. They may have been in a bad situation, but they might not even know it's a bad situation. So watching them come through your doors and encounter. I have 6 children in my home right now, so every time I say yes to a child, it's like an automatic play date for these children. And so I think that's been, and watching my children love kids going through something hard is my other favorite thing. But I have just a heart, and seeing the community wrap around kids has been another favorite thing of mine, just being involved in the foster care system.
That's great. Exactly.
And I'll second everything that Kate said and just say it really is, it's really exciting to be a part of something bigger than yourself, and to be able to, sometimes you have to dig deep and have a little bit of grit to, to open your home and do those things. It's not an easy thing, but it is so worth it to be able to just know that you're making an impact on a kid's life, even if it's just for a few short months or maybe years or maybe forever. It's just very, very meaningful to me and my wife.
Awesome. Great. All right. Well, thank you both for sharing those beautiful stories. All right. Joining me today has been the CEO of Foster and Heart, Kate Wilson, and Senior Project Manager at Optum Idaho, Zach Stahl. Thank you both so much for being here today and sharing these beautiful stories and sharing what you both do as well.
Thank you.